The exposure factors that are unique to human spaceflight pose the greatest health threats to our astronauts. And those exposure factors are microgravity, radiation, and isolation and confinement. So we're keenly interested in engineering approaches to mitigate those exposure factors. One of the first principles of occupational health, and we take very much an occupational health approach to the healthcare of our astronauts. One of the first principles of occupational health is to engineer away the untoward exposure. So if there's no microgravity, then there's no health threat from microgravity. If there's no radiation exposure, there's no health threat from radiation. So we try to engineer those things away. So as time goes on, I think NASA must never lose that principle and lose that focus, and always look for potential ways to engineer those exposures out of the equation. Thus far, we have no practical way of fully shielding against galactic cosmic radiation, and we have no way of practically producing microgravity. So at this stage of human space exploration, we're still in the phase of having to deal with the consequences of those exposure factors. So we end up with measures and countermeasures to try to mitigate the health effects of those. So we end up with things like very strong resistive exercise programs before, during, and after space flight. We end up with limiting space flight exposures. So far we're out to a year, but for our standard exposure on the International Space Station is 6 months. In the Space Shuttle era, it was a week or two, up to 21, 22 days, but or maybe a little longer than that. But we do have to deal with the untoward effects of space flight. So we're very interested in those untoward effects: bone demineralization, bone loss, muscle weakness, the stresses applied to the immune system in space, and what the ultimate consequences of those are. When astronauts go to space, they tend to shed virus particles in substances like saliva. We all carry virus particles embedded in our bodies in various places. Those are usually quiescent if you're in a low-stress environment on Earth. If you have a high-stress environment, say you're deployed to Antarctica for a long time, or you go to space, the immune system changes a bit, probably becomes a bit compromised, and those virus particles begin to shed. The question is, does that pose an infectious disease health threat for astronauts if they stay longer than 6 months or a year? So far, we haven't had any clinical problems, but that has to be a consideration going forward. Another good example is the emerged vision and intracranial pressure phenomenon, the ocular changes that occur in microgravity, that may be related to an imbalance between pressure in the venous system and pressure inside the cerebrospinal fluid exerts inside the head. We don't know the etiology of that. But in some astronauts, the changes to the eye are quite profound. It can become misshapen, kind of flattened from back to front. The most concern for that is the optic nerve can swell. And the retina begins to show signs of distress. And that has not to this point, but could, with prolonged exposure, potentially pose a threat to vision. So that's another concern. And then the effects of radiation that we know some of them. It certainly can cause cancer after a latent period passes. But radiation could also pose immediate threat in sufficient doses to the cardiovascular system, the the central nervous system. So those are only a few examples of the sorts of threats and concerns that we pay the most attention to and they're working hardest to mitigate.